mucus. But if you see cerebral spinal fluid actually excreting from extremities, that's another huge indication that you have head trauma, and you need a CAT scan to figure out if they need to relieve pressure, which basically means that they have to drill in to your brain to relieve pressure, and you got other stuff going on. So bleeding of the brain is called it generally leads to what is called a hemorrhagic stroke. So there's two types there. One is there's bleeding outside of the brain, and that's compressing and putting pressure on your brain, and to the point where your brain can't function, and you stroke that way. The other one is an ischemic attack, and that's when like a blockage prevents your brain from getting blood and oxygen, and it basically starts to die.
I think it's hot that you know all this.
The former is way worse than the latter, because the latter, there are treatment methods that can remove the blockage that sometimes if you're fast enough, that tissue won't die, and so that's when you have a TIA, that's a transient ischemic attack, so that's a stroke that you can recover from. If you have a hemorrhagic style stroke, that's likely something that you're not going to recover from, that you have permanent deficiencies, and that's generally like one side of your body is deficient as far as motor function and sensory, being able to feel, speak, like it affects everything. So that's when like you try to stick your tongue out, close your eyes, hold your hands out in front of you, and see if one of them like drops or wavers. There's a list of things that you can test for those sorts of things. But head trauma, concussion is a type of trauma, and it reduces to a depressed mental state, and that's scary because if that spirals, it means that your basic motor function will stop working, and that's bad. Put in really layman terms. Malin, can you name all 12 of the cranial nerves? No, I cannot. I can name most of... I think I remember the majority of like brain stuff. So I specialized in pre-hospital care. There are things that... The things that I learned are things that I am trained to fix, or was trained to fix, and anything that involves like a higher level of... Yep.
Yeah.
If it requires... If it requires treatment that is advanced, like at an ALS level, that's like slitting somebody's trachea open and breathing for them, or starting an IV line and pushing drugs to help your heart beat for you.
Didn't you trach someone once, though?
What?
Didn't you trach someone once?
I am not allowed to cut somebody. I can hold... If somebody else cuts, I can hold the crike. It's called a crike. Like, if somebody's getting criked, I can hold... I can spread the trachea open and hold tube in place and breathe for them. I'm not allowed to make the incision or place the tube. Same thing for RSIing, intubating, things like that. So, no, Sean-Luc, so brain stuff is not a pre-hospital care. You're not getting... If you have a brain injury, the EMTs and the medics that come to help, come to assist you, they're not fixing your problem. Our job is to get you to definitive care as fast as possible. That's called a load and fucking go. And if it's brain trauma or a femur fracture, that's generally in a helicopter to a level 1 trauma center. Ripped out. Okay. Sorry, that was a tangent.
Educational tangent. Look, we're in educational tangent.
Sensitivity. So fluids, sleep, no sleep, fluids. So anytime fluids. The reason why fluids are great is if somebody has low blood pressure. So anytime anybody who's ever from sitting position stood up really fast and gotten the stars, your brain feels kind of whoa, and you're kind of seeing stars. That's called a syncopal episode, and that's what happens when your blood pressure is lower than the rest of your body requires to oxygenate all of your organs. And that generally means that you're low on fluids, and you can fix, to some extent, you can fix your blood pressure if you have low blood pressure by getting fluids, which is why somebody with low blood pressure, they're also getting medication, but the first thing that we do is you start a line, and just saline solution is going to help regulate and stabilize your blood pressure because you're low on fluids. It's going to take 30 minutes or more, but if you have syncopal episodes, it's usually because you are super you are super dehydrated. And turgor, so like on your back of your hand, if you are super dehydrated, it's called tenting. You can actually pick up the back of somebody's hand and it will stay tented. So like wifey actually took a little bit to come down. She's dehydrated more so than normal. That was a little bit better.
I'm always dehydrated.
But yeah, like if you can pick up the skin on the back of your hand.
You dehydrated?
If you pick up the skin on the back of your hand, see how mine immediately goes down? Wifey,
Well,
come
aren't
over
you
here.
just showing off that you're all hydrated and shit?
So the amount of time that it takes to retract. See, wifey's is a little bit slower. That was actually better than it was a second ago. Hers is a little slower, so that's a sign or symptom that you can do to
Always
test
dehydrated.
hydration. And hydration is
Not coffee.
a way to help low blood pressure.
I have perfect blood
I
pressure.
thought no sleep, says Mary Todd. Yes, you do not want them to go to. You don't want them to go to sleep because if they're
how long?
asleep, it's difficult to know the difference between. So sleep is the equivalent as far as mental state, being awake, conscious, and being able to speak to you. Sleep is the equivalent of unconsciousness, and when you're unconscious, it's hard for us to know if you are unconscious, you're not allowed to have things in your mouth because you could choke on them because unconsciousness is.
How long?
You're getting into levels of.
That one time Jace had that really big spill that we were talking about where I was positive he had a concussion. And I called you, and you're like, is he tired? And I said, no. How long until, and that was in the middle of the afternoon.
Monitoring for 24 hours is generally like.
You did let him go to sleep that night.
Yeah. Sleep is still an important thing, but again, you want at least a couple hours to be able to monitor something.
Yeah, I think it was that happened at like the beginning of the afternoon, and he went to bed later.
Geek Boy, not exactly sure, but probably not a week. Says Geek Boy. Yeah, six days is when baby girl's getting her stitches up.
Yeah, she gets her on
all right,
6
I
days.
really need to go to bed.
Sorry, we kept you up.
Armor Hacks, have a good night, Alar.
Night,
Armor
night.
Hacks, you don't want to sleep until you can do a full assessment in case, along with the concussion, you have a full-blown subdural hematoma. Yeah, so again, brain swelling is a bad thing, and it only gets worse over time, so you want to allow the bruising to take full effect to be able to assess what the problems are. And so what you're doing is you're giving it a allotted period of time, hopefully at least a couple hours, to see if there are stroke-like symptoms or a depressed mental state. That's what you're looking for. Or a headache, or, anything in that.
But
general
Armageddon
vicinity.
makes a good point, though. There's no way to... No, actually, no, there's a way to know if Lena has a headache.
Yeah.
Lena will let us know if she has a headache. She takes my hand, and she's, like, crying.
If
and
she is
puts
crying
it-
obsessively,
and she
that's another sign.
She takes my hand, and she puts it on her head repeatedly, and that's her way of telling me, Mommy, fix this. Like, if she wants me to fix something, she puts my hand on it. So, last time she was sick, she just kept putting my hand on her head because she had a headache. We gave her
Armor
children.
Hacks. After that, you want to rest and not give added stress. Yeah.
Yeah.
Love to all. Night. Good night, Alara. Show me.
Night.
Malin, can you name all 12? Nope, I can't. Frieden with the unlurk. Welcome back, Frieden. I have a question. Frieden, hit us. Mary Todd, I ripped part of my ear, fell down a flight of stairs, and yes, alcohol was involved. Dude, let's go. King giving C-Bus the love.
Yeah.
Can we please talk about something else?
Yep, we're moving on, buddy. Frieden, how did you guys react to the death of Bob Saget? I was shocked, says Frieden. There were a lot of deaths right in a row, and they were all comedians.
Jace, stop.
No, we wanted to talk.
You want us to talk softer?
Yeah. Bob Saget, I think, was the youngest. Or was Louis? I think Bob Saget was the youngest of the bunch.
Stop that.
So yeah, it was crazy, dude. It was super nuts.
Okay, Jace, all done. You ready to go to bed?
Anytime anybody under 70 that is, I'll say, in good health or has enough wealth to take care of themselves that passes away is always nuts.
Yeah, it's very shocking.
Geek Boy, interesting. None of my injuries have involved alcohol, says Geek Boy.
Oh, mine have. Well, actually, the bad ones haven't.
Neither am I. Mary Todd also fell down a longer set of stairs. Can't remember that one as well. Go figure. Mary Todd. Just thinking of it. Sea Player. Once upon a time, there was a king who was only 12 inches tall. He was a terrible king, but he made a great ruler. Thank you for that, Sea Player. Mary Todd. American live in Wasilla. Is it Wasilla?
Yeah.
Wasilla, Alaska. Freed. Nice. I'm on the other side of the world. Ports. What is it called when a hereditary defect on an artery in the brain bursts? That's how my grandmother passed away.
Hereditary defect on an artery.